Have you ever heard about a condition that affects 1 in 10 women worldwide and often goes undiagnosed? It's called endometriosis. It's a global issue that's often overlooked. In this video, we will shed light on this silent epidemic, focusing on its symptoms and ways to manage it. Endometriosis, in simple terms, is a painful disorder. It's a condition that affects many women around the world, but it's often misunderstood or worse, undiagnosed. So what is endometriosis exactly? Well, imagine the tissue that lines the inside of your uterus, the endometrium. Now imagine that same tissue growing outside your uterus. That's endometriosis. This misplaced tissue can be found on the ovaries, fallopian tubes, and the tissue lining the pelvis. In rare cases, it can spread beyond pelvic organs. The problem arises when this tissue, wherever it might be, continues to act as it would within the uterus. It thickens, breaks down, and bleeds with each menstrual cycle. But without an exit route, the tissue becomes trapped, leading to discomfort and potential complications, such as cysts and adhesions. Understanding endometriosis is key to recognizing its symptoms, which we'll delve into next. Endometriosis symptoms are often mistaken for regular menstrual pain, which is why it's crucial to distinguish between the two. Endometriosis, an often misunderstood and misdiagnosed condition, presents a range of symptoms that can significantly impact a woman's quality of life. The most common symptom is pelvic pain, especially during periods, but it's not your typical cramping. It's often much worse and may increase over time. Pain during or after intercourse is another symptom that many women with endometriosis experience. This pain is not a standard aftermath of intimacy and should not be brushed off as such. It's a signal from your body that something might be amiss. Discomfort during bowel movements or urination, particularly during periods, is another red flag. Now, this doesn't mean feeling a little discomfort after a big meal, but consistent pain or discomfort that seems linked to your menstrual cycle. Excessive bleeding, either during periods or between cycles, can also be a sign of endometriosis. This could mean soaking through 1 or more tampons or pads every hour, or menstrual cycles that last longer than 7 days. Many women with endometriosis also struggle with infertility. In fact, some women only discover they have endometriosis when they seek help for fertility issues. Fatigue, diarrhea, constipation, bloating, or nausea, especially during menstrual periods, are other symptoms that endometriosis might be part of your life. It's worth noting that these symptoms might be mistaken for irritable bowel syndrome, further highlighting the complexity of diagnosing endometriosis. Now, these are just the common symptoms. Every woman's experience with endometriosis is unique. Some might experience all these symptoms, some only a few, and some might not have any noticeable symptoms at all. Remember, these symptoms may vary from woman to woman, and having one or more doesn't necessarily mean you have endometriosis. It's always best to consult a healthcare professional. Many misconceptions surround endometriosis, and they contribute to the delay in diagnosis. Let's debunk a few of these myths. One common misconception is that endometriosis only affects older women. This is not the case. It can start as early as a girl's first period and is often diagnosed in women in their 30s and 40s. But it's important to remember that age is not a determining factor. Another widespread myth is that the pain from endometriosis is simply regular period pain. This is not accurate. The pain from endometriosis can be severe and chronic, significantly affecting a woman's quality of life. It's not just bad cramps, but a serious medical condition that requires attention. Also, many people believe that endometriosis always causes infertility. While endometriosis can contribute to fertility issues, it does not mean all women with the condition will be infertile. Many women with endometriosis have had successful pregnancies. Lastly, some think that pregnancy or hysterectomy is a cure. This is not true either. While symptoms might improve during pregnancy or after a hysterectomy, these are not cures. Endometriosis is a chronic condition, and there's currently no known cure. It's easy to see how these misconceptions can lead to confusion and delay in seeking treatment. Awareness and accurate information are the first steps towards a timely diagnosis and effective management of endometriosis. Living with endometriosis can be challenging, but it's not insurmountable. This is a mantra many individuals diagnosed with endometriosis hold on to. It's a reminder that this condition, though life-altering, doesn't define who they are. Endometriosis, with its myriad of symptoms, can feel overwhelming, but remember, you are not powerless. There are ways to manage these symptoms and improve the quality of your life. The path to managing endometriosis involves a combination of medical treatments and lifestyle changes. On the medical front, there are several treatment options. Medications like pain relievers are often the first line of defense, providing relief from the discomfort associated with endometriosis. Hormone therapy is another option. By regulating the hormones that influence the growth of endometrial tissue, this therapy can help manage symptoms. In some cases, surgery may be considered to remove endometrial tissue. But treating endometriosis isn't just about medical interventions. It's also about making lifestyle changes that can help improve your daily life. Regular exercise, for instance, can help manage pain and reduce stress. A balanced diet rich in fruits, vegetables, and lean proteins can also have a positive impact on your health. Moreover, staying positive and maintaining a strong support system is crucial. Reach out to friends, family, or join online communities of people who are going through the same journey. The strength and understanding you can draw from these connections can be a powerful tool in your fight against endometriosis. It's also important to keep an open line of communication with your healthcare provider. They are your ally in this journey, and their knowledge and guidance can help you navigate your treatment options and make decisions that are right for you. Remember, living with endometriosis is not about enduring pain in silence. It's about seeking help, managing symptoms, and leading a fulfilling life despite the challenges. Endometriosis is a lifelong condition, but with the right approach, its symptoms can be managed effectively. So hold on to that mantra. You are more than your diagnosis. You are strong, resilient, and capable of living a full and vibrant life with endometriosis. To recap, endometriosis is a common yet often misunderstood condition. It's a health issue where tissue similar to the lining of the womb starts to grow in other places, such as the ovaries and fallopian tubes. It's more than just a bad period. It's a chronic condition that can have a profound impact on a woman's life. The symptoms can be quite varied, ranging from debilitating pain to fertility issues. The severity of symptoms doesn't always correspond to the severity of the disease. Some women may have extensive endometriosis, but experience little to no discomfort, while others with a milder form could be in severe pain. There are many misconceptions about endometriosis. It's not a condition that affects only older women or women who've had children. It can affect any woman of reproductive age, and it's not a result of lifestyle choices or something that can be cured with a change in diet or exercise. Living with endometriosis can be challenging, but there are ways to manage the condition. Treatment options can range from pain management techniques to hormonal therapies and even surgery, depending on the individual's circumstances and the severity of the disease. Remember, if you or someone you know is experiencing symptoms, seek advice from a healthcare professional. Together, we can break the silence around endometriosis.